Okay, so the global picture, once again, is extremely important, and Professor Bannerona will be back later to talk to us about some of the projects she's organized around this information. We promised you that we would have multiple survey results pertaining to survivors today, and so I'm extremely honored and privileged to invite to the podium Ronit Yarden. Ronit, I trust you're here. Yes, Ronit is here. And Ronit is going to share with us a very important piece of work, a very robust survey about multiple aspects of the young adult colorectal cancer experience. Ronit works with our partners at the Colon Cancer Alliance, and we really appreciate her being here. So let's give it up for Ronit.
Thank you. So thank you, Tom and Cindy, for inviting me, and thank you for the patients for sharing the story today and sharing the story with us, because without them sharing their story, this presentation wouldn't be possible. So I grew up in Haifa, actually, but now here. How do you, okay. So we did a survey. This is the third year we have done the survey. It's disseminated through our websites and multiple social media outlets where our constituents, which are patients and survivors, and their families are looking for information, as we are a patient advocacy group, the Colorectal Cancer Alliance. We are based in DC. The survey was disseminated for months, and then you can see that we got a lot of traction. We got 1,200 young onset patients and survivors who responded. There's a map here. You can see that it's from all over the world, but most of the patients and survivors were from the US. So we asked our survey respondents what were their symptoms that they had experienced before their diagnosis. And you can see, and I'm sure a lot of you who are here as a patient or your physicians, you're aware of those symptoms. And we heard of a couple of patients here that rectal bleeding was a sign that was actually sometimes overlooked, even though it's directly related to colorectal cancer, and also blood in the stool. We have a lot of patients who did that, and the rest of the samples, which are not, also are experienced by many other conditions and could be also not related to this particular disease, but vague. But it's the importance that we saw that many of our patients actually had experienced more than 3 symptoms altogether, and it's not just the one of the symptoms by itself. And despite patients having all those symptoms, majority of them took them more than 3 months to go see a doctor, and 1 in 4 actually waited about a year to see their doctor and talk about their symptoms. So patients also do not necessarily connect the dots and do not know that these symptoms could be related to colorectal cancer. We asked our patients and survivors how many physicians you had to see before your diagnosis. And you can see that some of them saw 1 doctor, but some of them had seen 2 doctors, and some of them had to see more than 3 and 4 doctors. So more than 67% of them had to see more than 2 doctors to see their diagnosis, to get their diagnosis. But 1 doctor could be misleading, because 17% of them is because they just went to the ER and that was their first time. And then 50% of those that saw only 1 doctor also saw that they were misdiagnosed, and that was resulted from seeing the same doctor over and over again. When we look at the age distribution between among the survivors and patients, we see that from those who had to see 3 and 4 doctors, more of them are the younger patients at 20 to 40, and had to see more doctors, saying that basically that the doctors also not associating the young onset with colorectal cancer. And there may be more agreeable to, with the 40 to 49 that could be at risk. And this is actually some kind of disparity on top of disparity, because when we looked at the different ethnic groups and populations, you can see that between Caucasians, Hispanic, and African Americans, as we go to 4 doctors or more, there's a disparity there as well. And African Americans and Hispanic patients had to see, more of them had to see more than 3 and 4 doctors. And then looking at how many of them had to see the were diagnosed in the ER, you also see that Hispanic and African Americans had more diagnosed in the ER settings. So we asked the patients and survivor, what stage were you diagnosed as? And you can see here that 71% of the respondents of the 1,200 people who responded to the survey were diagnosed at stage 3 and stage 4, and you also heard it today from the patients here. And this is skewed from what we know for the general population of colorectal cancer, because the older ones, probably because they get screened, are being diagnosed at early stages. And if you look at the diagnosis and the number of visits, so patients who had to see more than 3 doctors, you can see that they were diagnosed at later stages, so there is a correlation between the number of the visits and the stage that you were diagnosed with. We asked our patients and survivor what symptoms they had, what were they misdiagnosed for. And you can see that a lot of them, as we heard today, were misdiagnosed with hemorrhoids. There were also IBS and IBD. Some of them were related to gynecological issue or related to childbirth symptoms. And you can see there's a big proportion of these others. And I was debating to see what others means, and because others could be diffused. And then we had quotes from that you can see that the others were not necessarily medical. And it's just mind-boggling of how but I was told that I had colitis due to stress, because I told I'm depressed by a male doctor that I had no children, and I was not. And so there were on and on reasons for what others constitute. So looking at some of the psychosocial information that they've provided, 85% of the had suffered some psychosocial stress, and 55% of them sought help with them. We can see that 80% of the patient and survivor had children that are younger than 18, and again, we didn't talk about fertility and intimacy was mentioned here, but this is an area that needs to be strengthened by the medical and look into. So really, there's a lot of work that we need to do to increase awareness, both for the patients and for the physicians. We also, at the same time that we did this survey, we also did a young caregiver survey for the young onset patients. And we got 427 people who responded. And you can see here some of the issues that the survivor brought upon or were also mentioned in our survey. 60% of the caregivers did not get their answers right. So that is a problem with the caregiver itself, because the patient is usually not also quite focused on the medical issues, and we see that there's a big need for more information to be distributed in a way that caregivers can understand. 75% of the healthcare professionals did not provide information on support for young onset patients, and 50% of the doctors did not mention to patients and their family that their relatives are in increased risk and need to be screened more. We also looked at the caregiver psychosocials, and you can see a lot of them said that they had role change that was between partners and between parents and children. And then 80% said that they had multiple psychological effects that could be breaking down to what you see here, depression and stress and lack of sleep and loss of faith and so forth. And all this will be actually presented by a patient, Kim Newcomer, who is here in the audience and spoke earlier. So as a conclusion, we need to do better in bringing awareness to both the patients and the physician about young onset colorectal cancer. They are diagnosed late in stage, and that could affect their therapy options. There is a correlation between the late stage and the misdiagnosis. And actually want to bring some limitation because this was a survey that was disseminated through our channels, through websites and newsletter and a lot of social media. We were a little bit limited in terms of the distribution of the population, and you can see that we had a lot, more women and more white Caucasians in the population. In terms of what can you do with caregivers, they need more support. They need to understand better the disease and how they can help, and they need toolkits to help them through the journey. And I want to acknowledge Kim, who was instrumental with disseminating the survey, and the Never Too Young Advisory Board that you can see here in the picture, and other members of our organization who helped with this report. And actually, I didn't mention it at the beginning, but this is actually submitted to a peer review, so please do not disseminate it beyond here. And with that, I would like to thank everybody for your attention.
Well, that was fantastic and extremely educational, and a reminder that not all that is great has to be randomized, blinded, double-controlled to be useful, interesting, and helpful, and we wish you best of luck with publication of that. We are massively behind time. We don't regret 1 second of it, but I'm going to make some executive decisions. So, number one, we're not going to have a panel discussion of what you just heard. You can ask people questions. I'm sure they'll be delighted to see you at the networking coffee break, which I think we should go to right away unless Cindy strongly objects. I think we should do that. I think we should make that 10 or 12 minutes. And then we'll try and round everyone back up to get back in here for the all-important family health history ascertainment segment. So thank you all for being here with us so far. Let's go get some nice refreshments. And how about a round of applause for all these outstanding presentations?